Hi class, in this recording we're going to be going over PhysioEx exercise number 11, activity number 2, the ESR, erythrocyte sedimentation rate. And we're going to be focusing on the ESR, red blood cells, and the rouleau formation. As we look at the erythrocyte sedimentation rate, it's a way that we can measure how quickly red blood cells will become settle out in a vertical tube. Sometimes red blood cells, while they're settling out of solution, are going to stick to each other and form something known as the rouleau formation, which unfortunately is not shown in this lab manual, so I want to make sure that you can all see what that rouleau formation and as we looks like, and here you can see what that looks like. I just went to a image search, and if you see a bunch of red blood cells linked together end to end, that's a rouleau formation of red blood cells. And those rouleau formations are going to make it difficult for blood to flow as it sticks together. As we look at the equipment used in this experiment, there are some on-screen blood samples that you were given, and you were to take test tubes. And this part took me a while. You have to take this very first test tube and drop them in the test tube holders, and then add a blood sample to each test tube, add a little sodium citrate to the test tubes after adding the blood, and then shake and bake in an incubator, and then put them into a just an incubator, not shake them, just bake them in the incubator, and then put them in a magnifying chamber to measure the columns to see how the blood has settled out of solution based on our different samples. And here are our different individuals. We have a healthy individual, a menstruating female, an individual with sickle cell anemia, an individual with iron deficient anemia, an individual with a myocardial infarction, and an individual that has angina pectoris. And as we look at our data for this activity, let me clear here. We are going to skip all the way to the end to the activity questions. And we are looking at ESR. Why is ESR useful even though it is neither specific nor sensitive? ESR is useful because it allows for us to have an idea of how that individual's blood is flowing. As we look at our data, and let me skip over to here. As we look at our data, the ESR rates, or the distance that the blood has settled, varies dramatically. So some individuals have the blood settle quite a bit, like individuals 4 and 5 who have iron deficient anemia or are suffering from myocardial infarction. As we look at our healthy individual, I'm going to assume healthy male, and sample 2 is a healthy female, there was a little bit of settling, but not that much. An individual that has angina pectoris is probably leading into a heart attack, but isn't quite having a heart attack yet. So as we're looking at the settling, a little bit of settling is normal, tons of settling is abnormal, and no settling at all. As we look at sample number 4, somebody has iron deficient anemia, that is going to be abnormal settling. Let's close our screen here and go back to our post-lab questions. So as we look at the effect that sickle cell anemia has on sedimentation rate, why it causes there to be almost no sedimentation rate. Let's go back to the data. Sickle cell anemia is sample number 3, no settling. And as we look at somebody that has sickle cell anemia, their red blood cells are shaped like sickles, as opposed to being that wonderful biconcave donut shape that we're all so used to. So as we look at the sickle-shaped blood cells, those blood cells remain suspended in solution. They cannot fall out of solution, and there is no settling because of the shape of the blood cells. Our next question, question number 2. How did the sedimentation rate for the menstruating female compare to the sedimentation rate for the healthy male? Why do you think this occurs? So let's look at our data. As we look at the menstruating female, she had a sedimentation rate of 15. As we look at the healthy individual above, sample number 1, that individual had a sedimentation rate, or distance, I should say, of millimeters of 5. So the individual that was menstruating had more sedimentation compared to the individual who was not menstruating. And as we're looking at this individual who was menstruating, this individual that was menstruating is going to have more blood flowing out of their body, and in particular while they're menstruating, they are going to have a slightly reduced ability to clot their blood, causing that blood those individual red blood cells to fall out of solution individually quite quickly, as opposed to the healthy individual who is not in a period of, is not going through rapid blood loss and doesn't have altered blood clotting mechanisms in their individual body. Let's look at question number 3. How did the sedimentation rate for an individual with angina pectoris compare to the sedimentation rate of a healthy individual? Why? And then how well did the results compare with your prediction? So the healthy individual had a sedimentation distance of 5 millimeters. Angina pectoris had a sedimentation rate or distance of 5 millimeters, so they were identical. And when we look at this, a reason why they're identical is because that individual that has angina pectoris hasn't actually had anything significant happen to their circulatory system yet. They're just starting to get some pain, but they haven't had any major tissue damage yet that you would typically associate with sample number 5, the myocardial infarction. What effect, question number 4, what effect does iron deficient anemia have on sedimentation rate? Let's look at the data. Somebody that has iron deficient anemia, let's look at sample number 4, has an increased sedimentation distance. And this individual is going, with iron deficient anemia, is going to have reduced blood, the reduced concentration of red blood cells in their body. And that reduced concentration of red blood cells in their body will cause their red blood cells to be able to settle out of solution even more. There will be a more plasma within their blood. Let's look at question number 5. Compare the sedimentation rate for an individual suffering from a myocardial infarction with the sedimentation rate with an individual that has angina pectoris. Explain how you might use this data to monitor heart conditions. So when we look at the individual that is having the myocardial infarction, they have a sedimentation distance of 40 millimeters. And the individual that is having the angina pectoris has a sedimentation distance of 5 millimeters over that 1 hour. So in terms of sedimentation rates or distances, since I'm pretty fixated on this distance column right now, the individual that is having the myocardial infarction has a much larger sedimentation rate or distance compared to the individual that does not. And in terms of how we could use this data to monitor heart conditions, we can use this data to monitor heart conditions by doing a blood sample draw from the patient, and if they have a healthy sedimentation rate or a normal sedimentation rate, that's indicative or points towards that individual not having a myocardial infarction. And that is all we have for our questions. If you need any help, please feel free to post your questions or comments in the class discussion board. And as always, happy studies.